There is some debate as to whether or not placebos and nocebos have a place in medicine. The problem with prescribing placebos is that it is considered unethical to give a patient a placebo when they could be given true medication. However, placebos are used all around the world for varying diseases, and New Zealand is no different. The placebo effect is a beneficial effect produced by a placebo, which is a medicine or procedure prescribed for psychological benefit rather than physical. It cannot be attributed to the properties of the placebo itself, and so it must therefore be due to the person's expectations. Research on the placebo effect has focused on the relationship of mind and body. One of the most common theories is that the placebo effect is due to a person's expectations. It is possible that the body's own chemistry can cause effects similar to what a real medication may have caused. Experts also say that there is a relationship between how strongly a person believes they will get results and whether or not results occur. The stronger the feeling, the more likely it is that a person will experience positive results. The fact that the placebo effect is based on expectations doesn't make it imaginary or fake. Studies show that there are actual physical changes that can occur with the placebo effect. Opioid receptors are found in the brain, spinal cord, and other organs. When medications attach themselves to these receptors, they reduce the perception of pain. And so studies have shown an increase in the body's production of endorphins, which are the body's natural pain relievers. Finding ways to distinguish between the placebo effect and the effect of treatment can help improve treatment and lower the cost of drug testing. And more studies may also lead to ways to use the power of the placebo in treating diseases. The effect of placebos has been long researched in the past, and there are many pros to these procedures. The body has powerful natural recuperative abilities, and a placebo can help facilitate this. This is because when the human mind believes it is being given pain medication, it increases the amount of endorphins released, which, as I said before, are the body's natural pain medication. When giving patients placebos instead, it has the same effect, and the human body is using more natural remedies in order to reduce pain. Placebos act as a psychological boost, so a person's positive attitude may be important in recovery. This also brings in the nocebo effect. If a person believes that a treatment will not work, placebo or not, it is likely that it's going to have a detrimental effect on their physical health. When working with placebos, if the patient believes that it is going to work, it gives them a positive attitude, and so positive health benefits can occur. As is with everything, with pros there also come cons, and the placebo effect is no different. There is a chance that with chronic pain conditions or mood disorders, patients can show spontaneous improvement. This may not have anything to do with the placebo provided, and it's just a mere coincidence that the spontaneous improvement has occurred at the same time. Placebo effects can result from the mere contact with doctors, and even just the diagnosis of a problem. Simple attention from a respected medical professional alleviates anxiety. This renders the prescription of placebos moot, and it has no effect on their physical health. There is also the chance that a patient, in order to appease a doctor, will report benefit when no benefit has occurred, and this is known as the politeness effect. Placebos are used for a variety of things, from depression to stress to weight loss, and there have recently been studies in using placebos for vaccines. For some products, such as the influenza vaccine, there is very little data comparing the biological agent with a placebo. For the introduction of any new vaccine, standard requirement is a controlled trial using an inert placebo such as saline, which is delivered to a control group. A survey in New Zealand was conducted 5 years ago, its aim being to examine if patients agree with the use of placebos in clinical practice and to examine patients' beliefs about the placebo effect. A questionnaire survey was administered to 211 general practice patients in socio-economically divergent areas of Auckland. The results of the survey revealed that people were accepting of placebo use in certain clinical situations, and were even accepting of the use of placebos as a diagnostic tool. They considered placebo use more appropriate when it was for the benefit of the patient at the patient's request or when there seemed to be no alternative treatment. The conclusion of the New Zealand survey was that many patients are in agreement with the use of placebos, which suggests that the major issues of placebo use, which appear to be deception and lack of informed consent, are tolerated by the patients surveyed. Many of the people surveyed are willing to participate in a trial, and the most recurring answer in the questionnaire was in order to support the development of new treatment in order to help other patients. One of the problems with placebos is ethics, and many people believe that it is unethical to give people placebos when they could be given true medication. However, Guideline 11 of the International Ethical Guidelines for Biomedical Research states that it is acceptable to use a placebo with a control group if the use of the placebo would not add any risk of serious or irreversible harm. The placebo effect extends further than medicine. Scientists believe that using placebos could regulate the economy. That is, instead of spending $1 billion to implement complex economic policies that very few people understand, why not spend a fraction of that on policies that people do understand and inform them of how great the new policy is? In fact, the single most effective use of the placebo effect was during the European debt crisis, when Governor Draghi made a vague declaration that the bank would do whatever it takes in order to support indebted Eurozone members. Without saying anything specific, Draghi calmed the markets and allowed countries such as Italy to continue borrowing. The effects of a placebo are far less dangerous than some of the medications produced, and so by using these trials, medicine is advancing and creating safer medications. Obviously, not everything can be treated with placebos, and real medications do need to be prescribed to many people. However, the use of these placebos in medical practice can be beneficial in both the social and economic aspects, and this is why placebos should be allowed to continue in medical practice. Thank you.